Star Night.
Labor Day savings are going on now at all 11 Mermaid Mattress locations.
If you are waking up not feeling very good this morning, have some aches and pains, maybe Dr. Shawn Jones at Chattanooga Wellness could help. He joins us this morning, planning to talk about the K-laser that he uses in his practice. Nice to see you.
Hi, it's great to see you, Julie. Thank you for having me on this morning.
So you're very welcome. Am I right? It's the K-laser that you wanted to focus on this morning.
Yeah, the K-laser, we had it on several times. And the K-laser is a fascinating machine. It's a $30,000 laser because it's class 4, and it has 20 watts of power. So what that does, I'll turn it on for just a second here. But what it does, I got big fingers. So when I use the laser, all laser does 4 things. Laser decreases pain, it decreases swelling, it increases blood flow, which is the opposite of heat, which decreases blood flow and increases swelling, and it super heals tissue. Now you see my twin brother on. We use this on him, and I'm not pointing at anybody's face here, but the laser is very powerful. When we have it on, we're supposed to have goggles on if we point towards anybody. So I'm going to turn it back off for a moment. But this laser does amazing things. And he went from hand surgery, where they said he wouldn't move his finger for 5 months, to basically in 10 days his finger started moving again. It took 8 months to rehabilitate it, but it's a fascinating laser. So it's a big key in our practice. We use it with chiropractic care after car accidents. We use the laser to help super heal tissues, where we usually see people 25 or 30 times after a car accident. Most of the time we get people well in about 15 to 23 times, depending on how bad they've been hurt. It cuts down the amount of care that's needed on people. So,
wait. Did you say, I'm sorry, did you say that sometimes you'll use it as many as 25 times on someone?
Well, yeah, after a car accident, when you've had severe whiplash injuries, you used to be chiropractors would see you maybe 20 to 30 times over the course of 3 or 4 or 5 months in reducing frequency of care to get you well. Now, when somebody comes with a car accident, I can see them a lot of times 12 to 24 visits, depending on how severe the accident is. We cut down the time of care and the amount of care needed and save money by getting them well faster. So we use this with chiropractic care, and of course, one of the biggest things in our program is our neuropathy program. We have a 98% success rate with neuropathy treatment for patients. So if you're suffering from burning, tingling, pain, numbness, balance issues with your feet or hands, this K-laser is a big component, along with the nutrition program we have here, along with the chiropractic care for the extremities, the low back or the neck, depending on what's going on and what your surgical history is. In our vibration therapy, we have a program that you can reverse neuropathy. You don't have to suffer. And K-laser is a big part of that.
So let me ask you a couple of things, Shawn. You mentioned something about the 12 to 24 packages, and that way you can save money. Does this mean that if you come in, for many people, chiropractic care is covered by their insurance plan? Is this covered by insurance, or is this an out-of-pocket expense?
That's a wide open question. It depends. Insurance is, like Medicare doesn't cover any laser treatment. They'll cover surgical lasers, but not healing lasers. There's 2 types of care. There's degenerative care, which is the medical model, what the medical doctors do, and there's regenerative care that we do at Chattanooga Wellness Centers, which is rebuilding the joints, whether it's with our neuropathy program or our regenerative medicine program, where we have the nurse practitioner come in and do injections if needed in muscle or joints to help rebuild the cartilage. We always want to regenerate tissue, so we're all about regenerating things. We don't do degenerative care. We don't give pain meds. We don't do surgery. What we do is try to regenerate the body. The K-laser is such a cool thing. If you're having pain, what we're talking about is you can come in, and if you buy 5 laser visits, you get the 6th one free. And laser visits are not expensive. They're $60 for a laser visit to come in. And so people come in and buy 5 at a time, get a 6th one free, and they can get laser treatments. If you've had surgery, guys come in for 6 laser treatments after surgery, it'll heal in half the time, and complications and post-surgical infection rates go extremely low, way down. Of course, you got to pay for it yourself, but it isn't worth $100 to make sure you don't get sick.
So are you suggesting then that if somebody, let's say they've had a car accident, we'll go with that one since you mentioned it, and they've gone to see a physician, maybe they've gone to see an orthopedist about some problems that they're having, should they expect that the orthopedist either would also have the K-laser in the office that they're using, or would refer this patient to see someone like you?
Well, a lot of times they come in to see us first. We'll refer them to an orthopedist if there's an orthopedic need for potential like disc surgery or something like that. So, but no, most of the time they're not, because they're busy doing surgeries. They're not worried about the rehab part of that. That's what I do. So when you have a car accident, call Chattanooga Wellness first. Get right in to see us. And, we can come in and take care of you after a car accident. If you're suffering neuropathy, you can come in and get a full evaluation, examination, and your first neuropathy full treatment for only $49. That's including everything we do in the office, not just K-laser, but all the other things that we do to get you well and see how well it works for you. There's no need to suffer. If you're in pain, you need to call Chattanooga Wellness Centers in Cleveland and Chattanooga, because we can have ways to help with pain naturally without using opioids that are addictive or dangerous surgeries. We don't do any of that. What we do is get you better as fast and as affordably as we can.
Okay, and I do have to stay back, just because I talk to an awful lot of people on this show. There are some orthopedic surgeons who I talk to who would say, wait a minute, we very much do not go surgery first, and we very much do push rehab. So in fairness to that field, I do have to say that. But let me ask you this about what you're doing, because I think this is interesting to people. If they've, again, had an accident, if they have an x-ray, can you take a look at that x-ray?
Oh, yeah, absolutely. I like to bring normally the x-ray place, whether it's a hospital or x-ray center, will give you a disc. Bring it in with you when you come in for your evaluation. And let me say this, too. What you asked about, is the orthopedist going to do laser? No, they don't. They refer out to a physical therapist or somewhere to get rehab done. So I'm not saying they do surgery first. I'm saying you want to avoid surgery. And as far as I'm not talking about car accidents. I'm talking about as far as if you have a severe problem and looking at joint replacements, we can come in and do laser. We can do regenerative cell therapy, where we do use mesenchymal cells to regenerate that. There's things you can do before surgery. Yeah, I agree. Definitely, I think they want to be conservative too. But if you can avoid surgery, it's a lot of cost, a lot of pain and rehab. Good thing is, everything we do in our office, there's no downtime with any of it. With the laser, with regenerative cell therapy, with, of course, our neuropathy program works tremendous. And so really, neuropathy is one of those things where none of the doctors really have much to do but give you pain medication. They're kind of frustrated too. And
you mentioned the nutrition part of things, and we really haven't touched on that. So tell me how that factors in, and what do you do and to customize, I guess, an approach?
Yeah, we try to keep the nutrition concise. A lot of older people that have neuropathy, they don't want to take a lot of supplements and a lot of shakes and things like that. So one of the biggest things we use is Prima Dha from Standard Process. Now, Prima Dha is a great product because it decreases inflammation in tissues. So in your feet, your hands, if you have neuropathy, we put everybody on DHA. If they have emotional problems, stress, anxiety, depression, we use EPA, which is a form of fish oil that actually helps relax mental stress. And then if you're a normal person that has just kind of a little bit of stress and pain, we put you on a combination EPA, DHA. But our neuropathy patients take DHA, and that is one of the biggest things to take to help you get well. There's a few other products we use with nutrition on our neuropathy program. That's why when you come in, we do the full evaluation, and your follow-up visit's only $49. Gosh, you can come in and see a difference in the first visit. Every patient that comes in here, you can talk to them as they're coming in for treatment. They get results, and that's what we feel good when our patients have pain. And that's why our website is painreducing.com and laserawaypain.com.
Okay, then let's give people that information on the screen so they can see it. Shawn, thanks as always for your time this morning. Chattanooga and Cleveland locations. Laserawaypain.com is the website that he mentioned, and the phone numbers for either office, they're on your screen. Thanks again.
Hey, thank you.
Our kids and their teachers face some new challenges this year, and parents have some new concerns. Can students catch up? And how will schools keep your child healthy? Channel 3 School Patrol is taking your questions.